Definition of coronavirus. The highly contagious infection disease caused by a severe acute respiratory syndrome coronavirus 2 of SARS-CoV-2 has had a catastrophic effect on the world demographic, resulting in more than 6 million deaths worldwide at March 22, emerging as the most consequential global health crisis since the era of the influenza pandemic on 1980. The 2019 novel coronavirus or the severe acute respiratory syndrome (SNOCAL) is rapidly spreading from the origin on Wuhan city of Hubei province of China to the rest of the world. Several variants of SARS-CoV-2 have been described during the course of the pandemic, among which only a few are considered variants by the WHO, given their impact of global public health. And epidemiology of COVID-19, based on recent conducted China's CDC, is known as the most cost assured in mean 51.4% on occurred the age of 13 until 70 years, and occurred the age of 10 years, maybe 1%. As many as 81% of cases were mild cases, and 14 severe and 50 critical. People who are dead or who have inherited disease are known to be increased risk for mild severe disease. Old age is also thought to be associated with mortality rates. The Chinese CDC report the severe patient, 18 years of age, 14 decimal age, while severe is only 2.3%. The same thing one study in Italy, where the severe at 80 years was 20.2, will severe mortality as above increased congenital disease in the patient.
Etiology. The cause of COVID-19 is a virus belonging to the coronavirus family. Coronavirus is a positive single-strain virus, encapsulated and augmented. There are four main protein structures in coronavirus, namely protein N, nucleoplasmid, glycoprotein M or membrane, glycoprotein S or spike, protein E or seed. Next, transmission. SARS-CoV-2 can spread in two ways, namely direct contact and indirect contact. Direct transmission can be through spleshes, respiratory droplets when someone coughs or sneezes. While transmission is through indirect contact, if someone touches an object that has been contaminated by SARS-CoV-2, then the hands come into direct contact with mucous membrane such as eyes, nose, or mouth.
Tell you about pathogenesis from COVID-19. When SARS-CoV-2 binds to dendritic cell-specific intercellular adhesion molecules triggering non-integrins and their corresponding proteins in dendritic cells and macrophages, and then antigen-presenting cells move to lymph nodes to present viral antigens to T cells, are CD4 plus and CD8 plus T cell. The role of CD4 plus T in activating B cells is to increase the production of virus-specific antibodies. So, cytotoxic T cells that will serve to kill the virus but also play a role in lung injury. In addition, it also releases GM-CSF, which will be responded by circulating monocytes, which have high IL-6, so that the development of systemic inflammatory response be accelerated.
The next is common signs and symptoms of COVID-19 infection include symptoms of acute respiratory distress, such as fever, cough, and shortness of breath. In severe cases of COVID-19, it can cause pneumonia, acute respiratory syndrome, kidney failure, and even death. And some infected people do not show any symptoms and still feel well. And the most common symptoms of COVID-19 are fever, fatigue, and a dry cough. Some patients may experience aches and pains, nasal congestion, runny nose, headache, conjunctivitis, sore throat, diarrhea, loss of smell, or skin rash.
Until now, there are no specific vaccine or drugs to prevent or treat COVID-19. Treatment is aimed at symptomatic and supportive therapy. There are certain vaccine and drugs candidates that are still being researched through clinical trials.
As for protection for COVID are, first, wash your hand regularly for 40 to 60 seconds. Also use hand sanitizer for at least 24-30 seconds. 2. Avoid touching your eyes, nose, and mouth with unclean hands. 3. Use personal protective equipment in the form of masks if you have to leave the house or interact with other people. 4. Maintain a minimum distance of 1 meter from other people. 5. Limit yourself to interaction or contact with other people whose health status is not known. And the last, increase body resistance by implementing a clean and healthy lifestyle, such as a consumption of balanced nutrition.
In addition to national call centers, several regions also provide their respective hotline number in each region in Indonesia.